Avoid oatmeal if you have these health problems. Oatmeal has long been hailed as a nutritional powerhouse, praised for its high fiber content, low glycemic index, and numerous health benefits. However, while it is generally considered a healthy food choice, there are certain health conditions for which oatmeal may not be the best option. In fact, for individuals with certain health problems, consuming oatmeal could potentially exacerbate symptoms or lead to complications. Here's a closer look at why some people may need to steer clear of oatmeal. 1. Gluten sensitivity or celiac disease. Oats themselves are naturally gluten-free, but they are often processed in facilities that also handle gluten-containing grains like wheat, barley, and rye. Cross-contamination can occur during processing, which means that commercial oatmeal products may contain trace amounts of gluten. For individuals with gluten sensitivity or celiac disease, even small amounts of gluten can trigger adverse reactions, including digestive issues, skin problems, fatigue, and nutrient deficiencies. Therefore, it's crucial for those with gluten-related disorders to choose certified gluten-free oatmeal or opt for alternative grains like quinoa, rice, or amaranth. 2. Insulin resistance or diabetes. While oatmeal is often recommended as a healthy breakfast option for individuals with diabetes or insulin resistance due to its high fiber content, it's important to consider the glycemic index of different types of oatmeal. Instant or quick cooking oatmeal typically has a higher GI compared to steel-cut or rolled oats, meaning it can cause a more significant spike in blood sugar levels after consumption. For individuals who struggle with blood sugar control, particularly those with diabetes or insulin resistance, choosing lower GI foods like steel-cut oats or incorporating additional protein and healthy fats into oatmeal can help mitigate its impact on blood sugar levels. 3. Irritable bowel syndrome or digestive issues. While oatmeal is rich in soluble fiber, which can promote digestive health for many people, it may exacerbate symptoms for individuals with irritable bowel syndrome or other digestive issues. Some people with sensitive digestive systems may find that oatmeal worsens symptoms like bloating, gas, abdominal pain, or diarrhea. This could be due to the high fiber content or the presence of certain compounds in oats, such as lectins or avenine, which may irritate the digestive tract in some individuals. In such cases, it may be necessary to experiment with different types of grains or cooked oatmeal alternatives to find what works best for individual tolerance levels. 4. Histamine intolerance. Oatmeal is considered a low histamine food, making it generally suitable for individuals with histamine intolerance. However, some people may still experience adverse reactions to oats due to other factors, such as mold contamination or individual sensitivities. Oats are susceptible to mold growth, especially if they are stored in warm or humid conditions, which can lead to increased histamine levels in the grain. For individuals with histamine intolerance, consuming mold-contaminated oats could potentially trigger symptoms such as headaches, skin rashes, nasal congestion, or digestive discomfort. To minimize the risk of histamine exposure, it's essential to choose high-quality, properly stored oats and monitor individual tolerance levels. 5. Nut allergies. While oats themselves are not nuts, they are often processed in facilities that also handle nuts, which increases the risk of cross-contamination. Individuals with nut allergies, particularly those with severe allergies that can lead to anaphylaxis, should exercise caution when consuming oatmeal or oat-based products. Even trace amounts of nut proteins present in contaminated oats could potentially trigger allergic reactions in susceptible individuals. To minimize the risk of allergic reactions, it's advisable to choose oatmeal products labeled as nut-free or processed in facilities that maintain strict allergen controls. Before we continue, can I ask you to like this video and subscribe to join our community of healthy people? Thanks, and let's proceed. 6. Oxalate sensitivity or kidney stones. Oatmeal contains moderate levels of oxalates, naturally occurring compounds found in many plant foods. For individuals prone to oxalate sensitivity or those with a history of kidney stones, excessive consumption of high oxalate foods like oatmeal could potentially increase the risk of stone formation or exacerbate existing kidney stone issues. While oatmeal can still be included in the diet in moderation, individuals with oxalate sensitivity or kidney stone concerns may benefit from diversifying their grain choices and incorporating lower oxalate alternatives like rice or quinoa. 7. FODMAP sensitivity. FODMAP, fermentable oligosaccharides, disaccharide, monosaccharides, and polyols, are a group of short-chain carbohydrates that are poorly absorbed in the small intestine and can trigger digestive symptoms in some individuals, particularly those with irritable bowel syndrome or other gastrointestinal disorders. Oatmeal contains moderate levels of FODMAPs, including fructans, which may cause bloating, gas, and abdominal discomfort in sensitive individuals. For those following a low FODMAP diet or experiencing symptoms of FODMAP sensitivity, it may be necessary to limit or avoid oatmeal and opt for lower FODMAP grains like rice or quinoa instead. 8. Thyroid disorders. Oats are naturally gluten-free, but they contain a protein called avenin, which shares some structural similarities with gluten. While avenin is generally well tolerated by most individuals, some people with autoimmune thyroid disorders, such as Hashimoto's thyroiditis, may experience cross-reactivity between gluten and avenin, leading to potential immune system activation and thyroid inflammation. Although the evidence is limited, individuals with thyroid disorders who experience adverse reactions or worsening symptoms after consuming oats may consider avoiding oatmeal or opting for gluten-free alternatives like rice or buckwheat. 9. Sulfite sensitivity. Some commercially processed oatmeal products may contain sulfites, which are commonly used as preservatives to prevent discoloration and maintain freshness. Sulfites can trigger allergic reactions or sensitivity symptoms in susceptible individuals, including headaches, skin rashes, breathing difficulties, or gastrointestinal discomfort. To minimize the risk of sulfite exposure, it's essential to read ingredient labels carefully and choose oatmeal products that are free from sulfite additives or processed without the use of sulfite-containing preservatives. 10. Phenylketonuria. Individuals with phenylketonuria, a rare genetic disorder characterized by the inability to metabolize the amino acid phenylalanine, must closely monitor their intake of phenylalanine-containing foods. While oats themselves are relatively low in phenylalanine, certain oatmeal products, such as flavored instant oatmeal packets or oat-based protein bars, may contain added ingredients that contribute to higher phenylalanine levels. Individuals with PKU should choose plain, unflavored oatmeal options and consult with a healthcare professional or registered dietitian to determine appropriate portion sizes and ensure dietary compliance with phenylalanine restrictions. While oatmeal is a versatile and nutritious grain option for many individuals, it may not be suitable for everyone, especially those with specific health concerns or dietary restrictions. By considering individual health needs and making informed choices, individuals can tailor their dietary habits to optimize health and well-being while minimizing potential adverse effects associated with oatmeal consumption. As always, consulting with a healthcare professional or registered dietitian can provide personalized guidance and support in navigating dietary decisions. But what exactly happens when you eat oatmeal every day? We have discussed it in our video, which you can click right here.